Good. Perfect. Awesome. All right, we've got Brent here. He's been dealing with some low back issues. We've got him doing some exercises, so we'll show you those as well. But what we're going to start with first is putting some cups on his lumbar spine around those muscles and actually start to move them along the muscles. So we call that dynamic cupping. So what this does is it creates a little bit of a stretch in the muscles, decompresses the tissue, but what it does too is it brings blood flow to the area. You'll see the skin get a little bit red, and that just helps to promote that healing process. You let me know if it's at all uncomfortable, okay?
Okay.
So again, we're just trying to bring more blood flow to this area so we can get some healing promoted. The exercises that we have him doing are to help stabilize the lumbar spine and protect it, because he's got a fair amount of heavy lifting in his job and being able to go frisbee, right? So that rotation can be pretty harsh on the low back, but having good stability in the area helps to protect it. Perfect. So we see he starts to get pretty red. On this left side here, you can see a little bit of red dots, and that's called petechiae. And what that means is that there's actually a little bit of tissue damage, but again, this is to help let the body know that we need healing to happen here. So we're going to be done on this side. Now we got those red dots, a couple more passes here. But in these areas where the muscles just don't tolerate this stress, that's where we see those red dots start to show up, knowing that this area needs some healing. Perfect. So next we're going to do an adjustment on the lumbar spine. It helps to get things moving, WD-40 into those joints. All right, Brent. So first, let me have you lay on your right side for me, face me over here. He starts to move when I wind him up. Very good. Awesome. All right, let's go face up for me. A lot looser than last week. Last week, it started to get a little bit tweaky on him, so we gave him some similar treatment. But a lot better movement this week. Breathing in and all the way out. Good. All right, onto your left side for me. Click. Perfect. Awesome. All right, so come on upright. And he's all warm because he just got done exercising. So you're going to be good to go. You'll keep up with the homework.
Yep.
So if you know somebody who's dealing with some low back issues, adjustments help get the joints moving, a little bit of soft tissue work to clean up the activity in the muscles, and then educate those muscles with some exercises. That's kind of how we approach things here at Lake Effect. Call us at 989-686-6808. All right, so out here in the gym, we've got 4 exercises that Brent went over. He started with Earl. Earl is our ski erg. It is helpful to get that heart rate up. Heart rate increases blood flow, and that blood flow is what's going to help get that healing to that low back, similar to the way that we did the cups. Next, he did a kettlebell squat. So holding the kettlebell, this creates a little bit of a load on the front side of the body, so we want to fight that collapse, turning on these muscles here, building that strength so he can reach and do things at work. Chest up, squatting down, back up, nice and controlled. Working the hips and the low back spine erectors. Next, come over to the GHD. The GHD is something that helps to work on the glute ham developer, all right? And working with a row, it adds in an upper body component. So hop up on here. We get positioned nice and flat, head, neck, neutral, pulling back, getting a nice squeeze between the shoulder blades. Again, lumbar spine, erectors, stability, and strength through that upper back, promoting good, strong, upright posture. Lastly, he did a lap with Tina. Tina is our tank. This is something that helps to really fire up that posterior chain. As we push against this resistance, it pushes back. So I can push harder, and it doesn't let me go any faster. Once we get down to the end, we turn around and we flip. Again, this creates that load on that upper back and lower back, making sure we keep that good neutral spine. Trying to put him through as many positions safely as possible so that we can train that low back to be strong through everyday life. If you're dealing with some low back issues, this is how we approach it. Adjustments to get the joints moving, soft tissue work to get that muscle opened up and breathing again, and then teaching and coordinating those joints and muscles to work together with some exercises. If you know somebody or you're dealing with low back pain, call today, 989-686-6808.